Today we're going to look at how a student and a preceptor can use the telehealth features in ICE to collaboratively review a patient record. As a preceptor, I'm going to log into ICE, go to the telehealth area, and invite my student, George, to a telehealth session. As a student, in this case George, when I log into ICE, I see a notification that I have an unread message. When I click it, I can see that I have an invitation from the preceptor, Dr. Chandra, to a telehealth session. Clicking the link takes me right to the telehealth area, and we can start discussing the patient record together. To make things easier to review, I'm going to share my screen so we're both looking at the same information. Now when I load the patient's record, this is what the preceptor sees. It's my screen, in real time, all done from inside of ICE without using third-party web conference tools. Back to the student perspective, we can review the patient record by browsing any exam or health history forms, reviewing the treatment plan so far, including the procedure list, odonogram, and any progress notes. You can see here, from the preceptor's perspective, we can also use video to continue the conversation. Let's look at an example where a preceptor or a care provider can use the built-in video and telehealth capabilities to facilitate diagnosis and treatment of an unusual case. Mary, a patient of Dr. Taylor, presents with a chief concern of swelling on the roof of her mouth. Dr. Taylor has taken clinical photographs and radiographs of this and is unsure of the most probable diagnosis and treatment. He decides to seek the opinion of Dr. Mark, an oral surgeon in the hospital dentistry clinic across town, by arranging for a telehealth conference. During this conference, Dr. Mark shares his screen with Dr. Taylor, and the two discuss the case, focusing on the clinical photograph and radiographs in Mary's record. Dr. Mark is able to highlight to Taylor specific characteristics of the case that lead to a probable diagnosis and recommended surgical treatment. He and Dr. Taylor can then decide on the best course of action and appropriate next steps, thus eliminating an unnecessary consultation visit for the patient.